Good morning, all, and thank you for the introduction. So, polypoidal, as you know, is a condition characterized by formation of an aneurysmal polypoidal lesion with branching muscular network, which could lead to serous or hemorrhagic RPE detachment or oxidative retinal and subretinal oxidation and hemorrhage. The current standard treatment for polyps is anti-VEGF plus PDT, and the two main study which is done is the Everest 2 and the Planet study. And in the Everest 2, they compared ranibizumab or Lucentis single arm compared to photodynamic therapy plus Lucentis. And the study did show clearly the superiority of the combination arm in terms of visual gain and in terms of polyp regression. The Planet study compared Aflibercept monotherapy to Aflibercept plus PDT. The outcome of the study did show that monotherapy is non-inferior to the combined. So that's what we are, where we are now with the treatment of polyp. Now, PDT by its own has its own complication. It can increase risk of recurrent hemorrhage or oxidation and visual loss over time, possibility to choroidal ischemia and retinal atrophy, and it needs guidance requiring both training and specific equipment and special guide to do the test. So we are looking for alternative. Due to the side effect of the PDT and due to the good outcome of the SubLiminal laser in the treatment of diabetic macular edema and CSR, we designed this small pilot study to assess if we could add SubLiminal laser in the treatment of the chronic cases treated with Aflibercept with suboptimal response. And what the primary outcome was to see the OCT changes in the pigment epithelial height and fundus autofluorescence to assess the RPE changes. And the secondary outcome was to look at the changes in the visual acuity. 5 eyes of 5 patients selected. The duration of the study was 3 months, and the key study milestone was OCT changes in baseline, week 4, 8, and 12 visit. Also during this study, the data which is collected, visual acuity, color fundus photograph, OCT, fundus autofluorescence, ICG done only at the baseline visit to establish the diagnosis of polyp. This is the gender and ethnic distribution of the cases, and the mean age was 72-year-old. SubLiminal laser was offered to patients with suboptimal response. Suboptimal response, we defined it as patient on monthly injection of Aflibercept received 9 monthly injections with no change in the visual acuity or the height of the pigment epithelial detachment. We used the yellow 577 subluminal by quintal, and the exposure time was 0.2 milliseconds, spot size were 160, 5% duty cycle. The energy delivered to site. The site of the polyp, as I defined by ICG, and to the site of the pigment epithelial detachment on the OCT. The patient continued to have ILIA, but instead of monthly, become every 2 months after laser. 4 eyes show positive OCT changes. 1 eye didn't show any difference. In 1 eye, the pigment detachment did increase up to week 8, but then it showed decrease in the size of the pigment detachment. Change in the visual acuity was not statistically significant, and there was no change in the RPE seen on the fundus autofluorescence. That's the change in the pigment detachment, and you could see all the eye except 1 did show significant reduction in the height of the pigment detachment. This is the log mark visual acuity, and it didn't show statistical difference between before and after. I'm going to show you a few cases which we did. This is case number 1, which was the first case which I did, white Caucasian male. That's his vision before and after laser. That's his ICG. So the energy delivered to the polyp and to the pigment tail detachment. The energy which is delivered to the polyp is the same setting which is used for CSR, which is 50% titration, and for the pigment tail detachment was, again, 50% in this case. This is the OCT scan. So this is the eye which didn't respond, and we did realize that the 50% titration power was not enough, so we readjust the power to 70% on the pigment tail detachment side. Case 2, 71-year female. We did her left eye, and it did show improvement in the vision after laser. This lady did, as you can see, in week 8, which is the second OCT, show an increase in the size of the pigment tail detachment. But at week 12, significant reduction with disappearance of the subretinal fluid. Eighty-year-old African female, and that's her pre-laser scan, which show you can see here the pigment tail detachment and the intraretinal fluid, and then significant reduction in the, after 3 months in the pigment tail detachment and disappearance of the fluid. So, in conclusion, SubLiminal laser treatment can be a safe augmentation with the Aflibercept injection to maximize the response to the treatment in cases of unresponsiveness to Aflibercept. No change seen on the RPE, on the fundus autofluorescent. We need a larger randomized clinical trial to establish the safety and efficacy, but the results are promising with this pilot study. We need to offer the treatment at the early stage of the disease before permanent structural changes have been identified.